Thank you very much. We're going to dive right in. I'm so happy to see all of you here for a great occasion, very, very important work. And we're so grateful to all of you for being here this evening. You could have been somewhere else, but you know how important Black maternal health is and how we want to make sure that we improve birth outcomes for Black women. Because guess what, ladies and gentlemen, we are in it to win it. And for those of you who don't know me, we'll move right on to the next slide. I am Cheryl Brannon, and I have the distinct honor of being the founder of Sister to Sister International, as well as the convener for the Westchester Black Maternal and Child Center of Excellence. And we are excited. We're on the move. We've made some great impact, and we look forward to making even more impact as we move forward. So with that said, we're going to kick our evening off with a presentation by Kalia Jones. And this presentation is heartfelt. It's Kalia, who is an STSI Maternal Health Committee member, sharing her experience, sharing the downfalls, the pitfalls, and all of the emotional roller coaster, I should say, that she experienced during her pregnancy. But the good news is she came out on top, and we're so pleased to have her as a member of Sister to Sister International, our maternal health team. And we're going to go to the video. And what we would ask you is if you have any questions on anything that we go over during our presentations, to please put it in the chat box. And with that said, we're going to go to the video. We also have Kalia on our call here with us this evening. Thank you, Kalia, for sharing.
2017, I wanted to become a mother, and my partner and I were having a lot of complications, but we went through an IVF journey, and I found out in June of 2017 that I was going to be a mother because I was pregnant. Our embryo transfer was successful. It was the best time of my life. We were creating the family that we had always wanted. And found I was going to have a little boy. And the pregnancy was smooth. There were no problems. We found what I thought was a great healthcare provider. Actually, my OBGYN was amazing. And when I went in for my anatomy scan is when I realized that something was very wrong. And I received a call from my doctor, and I found out that my cervix was a lot more open than what it should have been. And so she was going to be transferring my care to a maternal fetal medicine doctor because I've now become a little high risk. But that evening, I actually wound up landing in the emergency room. They're doing a scan, and everyone's afraid to really tell me what was happening. And I overheard the doctor on call having a conversation with my OBGYN, and they were having conversations about a cerclage. Fast forward, I come out of the hospital. My OBGYN tells me, I think that you need to be on bed rest, just kind of stay off your feet, take it easy. So I go to Scarsdale, I meet this MFM, and she's telling me that I have an insufficient cervix, and that my cervix is opening, and that I can go into labor a little bit early, but we would need to figure out what my options are. And so I'm asking her, I said, okay, so what should I do? Should I go on bed rest? And she's like, absolutely not. You should continue to go to work. You should continue to live your life. You should continue to do all of the things that make sense. And I'm thinking, but my OBGYN told me that's the complete opposite. I said, well, can we talk about the option of a cerclage? Because after I found out what it was, that I actually am a candidate for a cerclage. And this doctor looked me in the face and she said, now, I'll never forget it. You've never lost a child before. And so therefore, you're not a candidate for a cerclage. And so I'm like, wait a minute. The goal is for us to make sure that I don't lose this child. She then goes on to say, well, we have someone coming in and I can sign you up for a study. And what I can offer you in place of a cerclage is a pessary. So I get a pessary and I have this rubber donut contraption placed inside of me. And she tells me to just go on and continue to go to work and live my life and do the things that I would normally do. And when I went home and I had a conversation with my OBGYN, she said, absolutely not. But I'm putting you on bed rest and I don't want you to get up unless you have to use the bathroom. We're not putting pressure on your cervix. And there was one day that I did have to get up, and it was to go visit this MFM again. And I was up a lot longer than I was told I should be. I felt like my child was coming out of my body. And when I got there, she says, okay, well, we should still do this echocardiogram. And she does all of that. And she knows that I am actively in labor. And there wasn't a moment of empathy or sympathy or anything that would make her feel like I need to have some bedside manner to help this woman get through the fact that she's losing her child right now. And she tells my partner to rush me to the hospital, and not the hospital that we were scheduled to deliver in. And I was once again met by a group of doctors that just didn't really seem to care about what I was experiencing. They checked my son. He was fine. He was healthy. His heart rate was good. There was nothing wrong with the baby. And they decided to ask me if I wanted them to induce my labor and force my son to be born early. And I should do so because who wants a child that's potentially going to have problems anyway? And I told them I didn't want to do that. And they sat there and they forced me to make a decision to... I not only gave birth to a son that was alive, that I held, that passed away on my chest, but I also almost lost my own life in the process. I struggled with birthing the placenta. I was hemorrhaging. I was rushed into an emergency DNC to have my placenta removed. I had to have 2 blood transfusions. It's the scariest thing I'd ever gone through. I naturally went into a bit of a depression. I felt like I didn't know what my purpose was anymore. My new purpose was I was going to be Andre's mother. What is my purpose, right? I am now a very, very proud mother of a 3-year-old little boy. But that first experience took so much away from me that it was very difficult for me to enjoy my pregnancy. It was very difficult for me to appreciate just all of the beautiful moments that I was experiencing because I was terrified of what would happen. My son lives on with me every single day, every day. I didn't lose him in vain. I didn't go through what I went through for no reason. I personally feel could have been prevented had I had the appropriate level of care and concern. And that's why the work that Sister to Sister is doing is so important in the Black maternal health space, because it is raising awareness of just the inequalities that exist within our healthcare system that are affecting Black and brown mothers. And when it was brought up that they were doing this work, I immediately raised my hand and I was like, I don't know what I can do, but I need to be a part of it. It was just something in my spirit said, this is what you should be doing. Helping people to understand what some of the things are that I've gone through will help Sister to Sister raise awareness. So that's what I think is beautiful. They're taking real life experiences, they're pairing it with the data, and they're trying to make a change. My name is Kalia Jones, and this was my maternal story.
Thank you so much, Kalia, for sharing your heartfelt experience. Certainly not something that any of us want to go through, but you came out certainly on the other side, and we appreciate you sharing that story with us and for joining us in our efforts as we seek to improve birth outcomes for Black women. So thank you, Kalia. Let's give her a nice round of applause and continue to wrap our arms around her. Thank you so much, Kalia. Okay, so now we're going to keep this train moving. We have our special guests who are bringing greetings. And let me just say that Senator Andrea Stewart Cousins was all set to join us, couldn't wait. And then, wouldn't you know, the governor called a meeting. And as you know, she's up in Albany in any regard, working on that budget. And so she sends her regrets. She's always with us. So we certainly appreciate her and know that she's doing a great job, certainly representing us up in Albany. But guess what? We still have some of our Albany support and our legislative support, and someone who's been a great champion for us. And, we are so pleased and proud to give you the floor. Senator Leah Webb, you've been rocking and rolling up there in Albany, and thank you so much for joining us this evening. Senator Leah Webb, come on down.
Hi, thank
You
you.
the energy a little bit. All right, good to see you, Senator.
Good to see you all
We
too.
appreciate you.
Cheryl, thank you so much for having me, and Clea, thank you for sharing your very powerful story that is transformative and a reminder and a call to action of why um, advocacy is so important, but centering policy. Um, Equitable policy and centering the voices of those who are often left out in these conversations, why it's paramount to anything that we do. So I want to thank you for sharing your story, and of course, Sister to Sister International for creating this space during Black Maternal Health Awareness Week. I have had the pleasure of representing Senate District 52 for the last 3 years. So that's in upstate. So that's Binghamton, Ithaca, Cortland area in upstate. But I have been a long champion of women's rights and most certainly improving access to healthcare, especially for women, for a very long time, well before being in the Senate. I I'm excited to be here, and at the same time, we know a lot of the statistics. I know many of the other speakers tonight will most certainly lift up the glaring statistics around maternal mortality in our state. Earlier this year, back in February, I co-hosted a joint uh, statewide public hearing about the state of maternal health, the crisis of maternal health in New York, with my colleagues in the Senate. And one of the many things that came out of that public hearing is that we have to have more culturally competent providers at every level, that we have to have providers that believe when patients are saying to them that something doesn't feel right, even if they don't have the medical jargon to articulate what that is exactly. And being able to know your body doesn't require you to be a, a health policy savant in order to receive quality care. That the importance of providing resources, not just simply with respect to having culturally competent healthcare providers, but also that we as a state have to continue to provide equitable investments through policy and through the budget. And so I know our esteemed leader in the Senate Majority Leader Andrea Stewart Cousins wasn't able to be here tonight, but I so appreciate what she continues to do in leading the charge for women in the Senate and in our great state. Every session since I've been in the Senate, we have introduced a legislative package specifically lifting up the importance of expanding access to maternal health care and reproductive care for women every single session. That's one of the top things that we do. And so I appreciate her leadership on this, along with my colleagues in the Assembly as well. And so, as the chair of Women's Issues, we continue to center this important issue because when you have a state like New York that ranks 22 in the country for the highest levels of maternal mortality rates, and then when you look at that number even further broken down based off of race, ethnicity, and geographical location and poverty level, those numbers become worse, especially for women of color. And so this is a mission we do not take lightly. And in fact, we continue to advance policies as we're currently deliberating in the budget to expand more supports for mothers and all birthing people. And so I want to thank you all who have taken the time to be here tonight for the work that you are doing, most of the work you will continue to do, and our collective progress that will be made because of everyone that's here tonight and those who weren't able to join. I just want to extend my profound appreciation to everyone. And please know that I'm standing right alongside with you, not just as a senator, but as a concerned uh, community member, advocate, and these are just the right things to do. So thank you so much for allowing me to bring greetings and continued equitable actions on ensuring that every birthing person has a quality experience, both pre and postpartum in our state and beyond. So thank you all so much.
Thank you so much, Senator Webb. We appreciate you and look forward to continuing to work with you as we seek to have pertinent legislation passed. And certainly you've been in the forefront, and we appreciate you being here this evening. That said, we are going to move right on. We have with us next Legislator Jewel Williams Johnson, who will bring greetings. And then we have our very own Health Commissioner, Westchester County Department of Health Commissioner, none other than Shirlita Amler. We really appreciate Jewel Williams Johnson. You'll hear more about some of the work we've been doing with her jointly a bit later in terms of our birth equity improvement project. We approached her and said, we'd like to do this. And she said, yes, let's make it happen. And she's been there with us side by side in terms of supporting our birth equity improvement project and really just being a great champion for Black maternal health and improved birth outcomes overall. So with that said, ladies and gentlemen, it's my pleasure to introduce to you none other than Legislator Jewel Williams Johnson.
Thank you, Cheryl. I always love your enthusiasm. It's a true honor to welcome everyone to tonight's powerful and very purposeful webinar on Black maternal health and birth equity during this nationally recognized Black Maternal Health Week. And I must begin by giving the deepest thanks to Cheryl Brannon, the visionary founder of Sister to Sister International and the convener of the Black Maternal and Child Center of Excellence. Cheryl is a tireless advocate, as you know, for Black women, mothers, and families. And Cheryl, your leadership continues to create space for truth, for healing, and for change. I also have to thank Cheryl Hunter Grant, Burl Weaver, and Erica Williams Woodley. Thank you for your tremendous efforts in co-hosting what will soon be a total of 3 vital town halls with me on this same issue. Your work continues to shine a light on the lived realities of Black mothers and children in our communities, and I'm endlessly grateful for your partnership and your passion. As a county legislator, I'm very proud that Westchester invests in this critical issue, allocating real funds and resources toward maternal health equity. But make no mistake, this is not just policy, it's personal. And I've shared my unsuccessful, very long IVF journey too many times. What I hope is that one day forums like this will no longer be necessary. But the truth is, the numbers are going in the wrong direction across this country. Since the overturning of Roe versus Wade, we have seen an escalation in maternal mortality, especially among Black women. And that is not a coincidence. It's a call to action, as was said earlier. Our marching orders are very clear. We must act, we must advocate, and organize until birth equity is not a dream, but a standard. We need more Cheryls in this world, but tonight I'm so deeply thankful to be amongst you, warriors for justice and equity. My conscience and my heart simply wouldn't allow it any other way. Let's keep doing the work. Let's keep showing up. Let's fight for a future where Black mothers not only survive, but they thrive and thrive and thrive. And I thank you. I thank you. I thank
We thank you. Let's give her a nice round of applause. We thank you, Legislator Jewel Johnson. And I tell you, we're so blessed to have great partners like you and Senator Webb, and not only here in Westchester, but certainly New York State and certainly across the country. So again, thank you so much for your support, your passion. And like you mentioned, you have your own personal story. We all have a testimony. So again, it really is a good thing when we can come together to promote equity. So thank you again. Moving right along. And again, if any of you have any questions or comments, you can put them in the chat. Thank you again, Legislator Johnson. We're going to keep this train moving, this equity train in terms of improving birth outcomes for Black women here in Westchester County. So that said, Sister to Sister International has been pleased and proud. I'll tell you, we're really blessed. We work hard. And we're so happy to work closely with certainly Commissioner Shirlita Amler. She's been with us for some time. She said yes when it was time to collaborate about Black maternal health here in Westchester County. And she's been a true champion. And you'll hear more about how we partnered with both she and certainly the county overall. So we're very grateful to you, Dr. Amler, always there when we need you. So you have the floor, and we're delighted to have you bring greetings.
So good evening.
Good evening.
I'm pleased to join you, Cheryl, and Sisters to Sister International during Black Maternal Health Week to highlight our shared goal of improving Black maternal and child health outcomes and reducing racial healthcare inequities. At the Westchester County Department of Health, we greatly appreciate our partnership with Sister to Sister International and the other community partners who are working, all of them collaboratively, towards achieving birth equity in Westchester County. We are proud that our county supports with our county's support, more families have been provided with prenatal and birthing consultations, group prenatal sessions, and postpartum support groups through Birth from the Earth. County funding has also enabled the Children's Health Research Foundation, Lower Hudson Valley Perinatal Network, and that is a mouthful, to expand its prenatal and postpartum home visits for residents in areas where adverse birth outcomes, such as low birth weights and premature births, are more common, and to offer virtual and in-person breastfeeding support. And with the county's support, St. John's Riverside Hospital's maternity department is strengthening its data analytics and working to enhance its support systems and the overall birthing experience for Black women and their families. And I am also excited to share that earlier this week, County Executive Ken Jenkins announced the launch of a new maternal health dashboard. And you can see the QR code on the left here. This is on the county website, and it offers a deep dive into data about maternal health and births in Westchester. We hope you'll all visit this. This dashboard will help us track our progress as we work to improve Black maternal and child health outcomes and reduce racial and healthcare inequities. While data alone can't solve these problems of greater maternal and infant mortalities or higher C-section rates for Black women, this dashboard is a powerful tool that can assist policymakers, advocates, grant funders, and program managers by informing their decisions with granular information about the root causes of birth outcomes. The data dashboard will help keep Black maternal health equity front and center and can point the way towards possible solutions. I am looking forward to hearing more tonight about the accomplishments of the Westchester Black Maternal and Child Center of Excellence and to working together to further our shared goal of improving Black maternal health outcomes. I thank you all for joining us on this very important mission, and I look forward to hearing the other great speakers. Thank you so much for having me.
Thank you. We always appreciate you as well. Thank you again. And as we move along here, we are so pleased and proud to have a leader here in Westchester County. I mean, you know, again, we kind of use a land, air, and sea approach. We've got the county, and on the county level, we not only have the Department of Health, but we have a body, the County Exec's Office, that has been leading this charge. And certainly we give credit to our former county executive, George Latimer. But guess what? Right by his side was his deputy county executive, and that was none other than the Honorable Ken Jenkins, who is now the county executive. And he's been there with us every step of the way as it relates to being a strong advocate for Sister to Sister International and our birth equity work, and certainly uplifting our Still I Rise, the Status of Black Women and Girls report that focuses on not only Black maternal health, but it focuses on entrepreneurship. It focuses on STEM and STEAM for girls. It focuses on social and juvenile justice, and of course, health and wellness and Black maternal health. So ladies and gentlemen, it's my esteemed honor, it's our pleasure, and it's certainly something that I am very pleased to do right now, and that is to give the floor to none other than our esteemed county executive, a great champion. Ladies and gentlemen, the Honorable Ken Jenkins.
All right, Cheryl, thank you so much. And it's a great privilege to be with you all tonight during this Black Maternal Health Week as you're continuing to bring the information. We heard from Dr. Shalita Amlin, certainly my colleague on the Board of Legislators, Julie Williams-Johnson, and we're going to continue from the county's perspective to help continue to make sure that we continue to do our level of investment to partner with all of you to improve Black and brown maternal health outcomes. And we see how this is so important right now in this really critical and challenging times. You know, we're going to keep working as hard as we can together to navigate through these challenging waters, but our county commitment is not changing. We're going to continue to move forward with all levels of investment, even though we see some of the things that are happening at the federal level. And with our friend and partner, the 9th County Executive, George Latimer, and Congressman George Latimer now, that we're going to work as hard as we can to move forward. This is so important that this information has to continue, and we have to continue to make sure to have the level of conversation, advocacy, and partnership that Sister to Sister has always done. So again, thank you so much for having the opportunity for me to say some words today, but more important, the information that you're going to share today is the really important item. So again, thank you so much, Cheryl, for the opportunity to say hello to everyone again during this Black Maternal Health Week, as we continue to keep the train moving forward on behalf of all Black women and maternal health outcomes. We know it's still a challenge and it's a nationwide problem, a worldwide problem, but we're here together to make a difference. Thank you so much.
Thank you. We appreciate you. And as the world should know that you're also a new grandfather now, aren't you?
Yes, ma'am. And thank you, Levi is right now he's going to be going into his third month in May, so February 3rd, and we're really happy with that. I'm looking forward to seeing him this weekend, being the second time I've seen him since he was born. And again, for everyone that is recognizing and celebrating Easter, happy and blessed Holy Week season for you. But again, this is so important information that's happening tonight. So again, Cheryl, thank you and your leadership for the continued work to making sure to uplift Black maternal health outcomes. And the data is there. You know, when the work happens and the programs that Dr. Amla and you partnering together with, it has made a great, great difference. So thank you so much.
Thank you very much. And we also want to shout out Debbie Jenkins, First Lady here in Westchester County as well as grandmother. Yeah. Okay, good. Thank you so very much. We appreciate you. Moving right along, I think that is the extent of our greetings, our esteemed greetings. We really appreciate the support. And now we're going to transition into spotlighting the Westchester Black Maternal and Child Center of Excellence. And again, we're so happy to have all of you on with us this evening. So please make sure that you make note, shout yourself out in the chat box. And again, if you have any questions, please be sure to put those in the chat box as well. So again, it's now my pleasure to walk you through an intro of the Westchester Black Maternal and Child Center of Excellence. And then you're also going to have the opportunity to receive a sneak peek at our new website, new and improved. So with that said, we're just going to pull up my slides, if you'd be so kind. And I'm going to give you some basic background. Some of you have asked about stats and things of that nature. You're going to hear more about what the current state is here in Westchester as we move along. We've got some great, great speakers. So that said, as is noted here, it takes a village to improve birth outcomes for Black women in Westchester County and beyond. And we just want to put that in slide mode. Because again, this is Black Maternal Health Week, and we are so pleased and proud here in Westchester County. Certainly it's a problem, one we would rather not have, but the good news is we recognize that it's an issue and we want to come together to do all that we can to improve birth outcomes. So that said, we're going to move right on to the next slide. Okay, STSI started out on this journey back in 2000. We had a Mama Kid Safe Birthing campaign in Africa. We did that in collaboration with the World Health Organization. We have a Sisters Beating the Odds and Claiming Wellness campaign now over 30 years ago, almost 30 years ago, launched in 2003, so over 20 years. And it's a wonderful campaign that encourages women to know their stats. The tagline is knowing your stats is where it's at, because if you know your stats, then you can do something about them. So this is something that we use not only for women on an ongoing basis in general, but certainly it's very important for birthing women as well, birthing people. Moving right along. Next slide, please. So that's how we started out on this journey. Then we did some seminal research. Still I Rise, status of Black women and girls in Westchester County. And we researched the Black maternal health pillar. We had 4 pillars I mentioned earlier. Black maternal health was one of them. So again, this is when we determined that, yes, we've got a problem. What's our current state? What's our desired state? And what strategy are we going to put in place? Next slide, please. So we actually had a ribbon cutting, again, on our journey with the Westchester Black Maternal and Child Center of Excellence. And we did this during a screening of Aftershock, a very, very poignant movie that lifts up the journey of a Black woman, the loss of her child. And certainly Nubia Earth Martin was also featured in it, and she's a member of our team. So we were happy to host that screening, which actually raised up teen birthing as well, which you'll hear more about in the future, in addition to the ribbon cutting for our Westchester Black Maternal and Child Center of Excellence back in 2022. Next slide, please. And we have 4 pillars: community engagement, education policy, systems, and change. We have a dashboard, and we're happy to partner with the Westchester County Department of Health on the dashboard, funding and capacity building. And it really does take a village. It's using a collective impact framework. Next slide, please. And again, we brought partners to the table, working with Westchester County government. We were happy to have partners funded and continue to work collectively, again, to advance this cause. Next slide, please. It's like it. Okay, so the journey continues. You'll hear more about the Birth Equity Improvement Project. We collaborate with the Maternal Mortality Review Board and Cheryl Hunter Grant, who's been doing a great job, who chairs their advisory council. She's a member of our team as well. Teen Birthing Launch with St. John's Riverside Hospital, the first in the state. That's coming up. We're happy to partner with them. As well as the Department of Health. We have our Day of Action, all kinds of wonderful things going on in the community. 2025, we have Black Maternal Health Week webinar, which we have now. And then, of course, we want to continue to expand our Birth Equity Improvement Project. Next slide, please. And you can just see these wonderful photos from our Birth Equity Improvement Project, many of our community partners, our health fairs, and the like. Lots going on. We've been rocking and rolling. Next slide, please. And of course, we have today our Black Maternal Health Week event. And again, we're so happy to have all of you here with us, all 80 of you, 80 plus. Okay, moving right along. Next slide. Thank you so very much. And guess what? If that were not enough, that great introduction, now you're going to have the opportunity to take a look at our enhanced, our improved website that has a number of different resources, again, to support our various different target audiences in their endeavors to help us in support the birthing process for Black women, as well as to improve birth outcomes. So with that said, we're going to turn it right over to Beryl Weaver. And Beryl Weaver is our management consultant, our community partner liaison, and she's been doing a fabulous job. And she's now going to give you a brief overview of our website. Is the crowd roaring out there? Hello, got to pick up the energy. It's a celebration. We're making progress.
Thank
Okay.
you. Thank you, Dr. Cheryl. Good evening, everyone. We're so happy and excited that you're here because we're celebrating and recognizing Black Maternal Health Week. So we're very happy that you're here. I'm going to take a few minutes to walk you through the beautiful Black Maternal and Child Center of Excellence webpage. Before I do that, though, I just want to tell you that it is beautiful. It's easily navigated and very user-friendly. It is the premier resource center for all things Black maternal health. And it is not only for the birthing people who is pre-pregnant, during pregnancy, and post-pregnancy, but it also serves as a resource center for providers, as well as community partners and the general public. So here we are at the landing page. When you type in wbmcce.org, it takes you to our landing page. It says, it takes a village to improve birth outcomes for Black birthing people. the WBMCCE umbrella and the pregnant woman is our branding and logo page. So there are 4 navigation. Before I do that, we have a donate page, and that is self-explanatory for anyone who wishes to donate to our cause. The homepage is the bulk of where all of the information resides regarding to being pregnant, during pregnancy, and after pregnancy. The initiatives page, I'll come back to the homepage later. The initiatives navigation button shares with you the 4 pillars of our focus. 1, community engagement and partnership. 2, our initiatives for training and development. 3, data research, and you will see when you get there, we will link to St. John's Riverside Hospital data dashboard, the Westchester County dashboard, and the national dashboard information. And that will be the latest information that you will see in those initiatives. And the 4th is our funding initiatives. Events is self-explanatory and shares our current events and upcoming events. Resources provide a number of resources for any stage of the pregnancy, and we will go through that if we have the time. And press releases and media takes you through our various press releases, initiatives, and media information. So here, I'll go through, this is our welcome page. Information about Sister to Sister, our goal, vision, and goal statements. Here, Westchester in Action presents to you some of our recent initiatives of community partner recognition and various activities that we have done. Okay. Go back to the homepage. Just bear with me for a moment.
Just hit the X, Beryl, the X to the right.
Okay, that takes me where I want to go. Excellent. And so here we are at the home page, continuing, that shows pregnancy, before pregnancy, during pregnancy, and post-pregnancy. And here we have a disclaimer that shares that this is information provided to you. It's not medical information, and that you should consult your provider, as well as if there's an emergency to contact your call 911. You'll read additional information pertaining to each of the activities or stages of pregnancy. And you're sharing here today is our Black Maternal Health Week recognition. Continuing on the homepage, you see Westchester Maternity Community Partners listed here. St. John's Riverside Hospital is our primary partner, Birth from the Earth, as well as other partners. We have a sign-up page for our newsletter and various updates that we have. This is the WMBCCE team, Dr. Cheryl Brannon, Cheryl Hunter Grant, myself, Dr. Greenwich, Erica Williams, Woodley, and Gloria Cunningham, who is our webmaster. We also have here the legislation of Black Maternal Health Omnibus Act. Continuing here, the umbrella on the 3 stages of pregnancy and our community partners listed. How am I doing on time? Do I have some more time?
Not much. We got to keep it moving.
Okay, we have a contact page that you can sign up for our press releases and information. And so I would like to invite you to go to the website, which is wmbcce.org, and peruse and see what you find in more depth. But we're just so happy and excited to present this information to you tonight. And thank you for your patients and your participation. Thank you.
Great, thank you.
So-
Great job, Beryl. Let's give her a nice round of applause. Amazing, absolutely. Thank you so much. And we want to shout out, you saw certainly our community partners spotlighted. We could not do this without them. And I tell you, we're very blessed to have some great community partners. We've got everyone from the Westchester Women's Agenda. We have the Westchester Children's Association. We have certainly the Westchester County Office for Women. We've got the Westchester Women's Advisory Board. We've got the National Council of Negro Women. We've got the Zetas. We got the Deltas. And I know, Senator Leah, you're a Delta girl. I do know that. And so many others. We are just so blessed to have a wonderful, wonderful cadre of community partners. And we want to shout you all out, say thank you. And we also want to make note that we have members from the Teen Birth Team that you'll be hearing more about that we encourage to come here to Westchester, the teen birthing modality. So St. John's is going to be launching that, one of our great community partners. And we're so happy to have the Teen Birth Team from Harvard University with us, Arianda Labs, in addition to St. John's Riverside Hospital. So with that said, we're going to keep the train moving, and I am now going to turn it over to none other than Erica Williams Woodley, a member of our team, nurse practitioner, does a great job, and is now working for the New York State Department of Health, and just does a fabulous job. She's going to introduce our moderator. Erica Williams, you have the floor. Thank you.
Okay, so I'm honored to introduce our panel moderator for tonight, no other than Dr. Suzanne Greenwich, who is a board certified American Board obstetrics MD. She is presently a senior attending at St. John Riverside Hospital and St. Joseph Medical Center in Yonkers, New York. Dr. Greenwich has over 30 years in private practice, experience with interest and expertise in fibroids, menopause, and minimally invasive surgery and laparoscopic robotic surgery. That's right, I said robotic surgery. She is the founder and CEO of Woman to Woman OBGYN, a comprehensive practice, private practice serving over 40,000 women and delivering over 200 plus babies each year in the city of Yonkers, New York. It is without further ado that I present to you Dr. Suzanne Greenwich.
Great.
Yay.
Wow, thank
And the
you.
crowd roars.
The crowd roars. Thank you so much. Well, welcome everyone. All almost 80 of us on here. So exciting. And I'm so happy to be here. I'm happy to be your moderator tonight. I am welcoming everybody to tonight's panel of it's an opportunity for us to hear from some thoughtful leaders. We've already heard from a patient. Kalia, your story was amazing. Thank you so much for sharing it with us and bringing that passion and truthfulness and bringing us what patients go through sometimes on a daily basis. But we're here to really highlight some rock stars right now that's going to help us navigate these waters tonight. They are frontline advocates. They're driving meaningful change in maternal health. Right here in New York and Westchester, of course. Our focus is not on the challenges, though. Our focus is on solutions and rooted in advocacy, joy, and equity. This week, what is this week? This week is Black Maternal Health Week, right? This week is not just symbolic. It's a call to action. To dismantle systemic barriers, uplift culturally centered models of care for Black birthing people. So together, we'll explore how to return the joy to maternal journey, why doulas and midwives matter, the advocacy that shapes policy, and the role of implicit bias in healthcare delivery. So my first rock star, very, very special person, friend of myself, Dr. Ashanda St. John, is a board certified obstetrician and gynecologist for over 25 years of experience. And I must mention, I have worked with her side by side in the past, and she is dedicated to advancing women's health, particularly with underrepresented minority communities. She's a graduate of Sophie Davis. She's from the New York Medical College. She completed her residency in Danbury at Yale. She held significant leadership roles, even presently chair of OBGYN and Health Alliance, and she's a part of the Westchester Health Network, and she is a clinical associate professor at New York Medical College, and she mentors future physicians. Her focus on racial disparities in healthcare, promoting equity. She's contributed to reducing cesarean sections, reducing morbidity and mortality, and improving mental health access and holistic prenatal care. In her presentation tonight, titled Returning the Joy to Maternal Journey, Dr. St. John will share insights on creative, positive, empowering experiences for birthing individuals, emphasizing the importance of joy, please, and humanity in maternal health care. Please join me in welcoming Dr. Ashanda St. John, a passionate advocate and leader in maternal health equity.
Thank you so much, Dr. Greenidge. It is with such esteemed honor and such humility that I can boast that we have operated together and worked together side by side. So it has always been an honor of my life to learn and work alongside you. So thank you for that. I am happy to start the presentation. If we can cue the first slide. Okay, so some people may ask, why are we talking about this, right? And so we know that this is Black Maternal Week, and we need to celebrate it. But I think also what we need to recognize is that sometimes that maternal journey is not filled with joy. As our patient advocate had told us in the beginning of this webinar, is that, sometimes there is not joy in that maternal journey. And so what we want to do and really focus and ground ourselves on tonight is returning that joy in the maternal journey. Next slide. So a little bit about myself. I was the former chair of OBGYN Health Alliance. I am an associate professor. But one of the callings that I must also ground myself in is that I'm the co-chair of the New York City Department of Health Maternal Mortality Review Board. And I'm also a member of the state Maternal Mortality Review Board. And what we have learned is that through trauma, we also can really kind of develop what our purpose is, and that helps us really function in our path forward. I became an OBGYN 27 years ago, and I thought that I was going to be a part of the best day of someone's life until a maternal death occurred at a hospital that I worked at. And that's when I realized that, it's not always the best day of someone's life. And that day can be filled with trauma and pain for not only the partner, the child, but also families and communities. And so what it helped me really focus on is how can we really kind of restructure what we do so that we can prevent any of these traumas happening. So next slide. So again, we are talking about this because it is in the news. This is what our patients hear. They hear news topics like on CNN, the wealthiest Black moms are more likely to die in childbirth than the poorest white moms. We also see that the nation is battling maternal health crisis, where women of color are choosing birth centers over hospitals. And then we're seeing reports of 1 in 5 women, even more Black and Hispanic mothers, report mistreatment during the maternity care. And then what is the most troubling is we see another Black woman is dying in childbirth at a hospital in Brooklyn. So next slide. So again, we talk about this, but one of the things I love that Dr. Almer brought up is that we have this Westchester Department of Health Maternal and Infant Dashboard. And if you click on the QR code, that will take you right to that dashboard. So let's talk about what are the stats for Westchester. Well, between 2017 and 2021, there were 46,832 live births. 7,913 were from Black women and Black birthing people. Now, the majority of these Black mothers and Black birthing people, they delivered in Yonkers, which was 22.05%. Second was White Plains at 8.99%. And the last was New Rochelle at 7.98%. And what we saw is that 29.4% of Black women and Black birthing people had 6 to 9 prenatal care visits, and 7.5% were considered high-risk pregnancies. And we also looked at kind of what are the comorbidities, right? What really kind of essentially makes somebody high risk? Well, 2.23% had gestational hypertension, means high blood pressure that was acquired during the course of the pregnancy, and 1.52% had chronic hypertension, meaning that they had high blood pressure before the onset of the pregnancy. Now, when we think about pregnancy complications, 6.14% had gestational diabetes. That means diabetes that was acquired during the pregnancy. And 1.06% had pre-gestational diabetes, meaning that they entered the pregnancy journey with already having diabetes. We saw that 20.97% had a previous C-section, and 3.30% had a previous preterm infant. So these are your stats for Westchester between 2017 and 2021. Again, I encourage you to use the QR code to really kind of explore what the dashboard has, because it is quite detailed. Next slide. So let's talk about New York City, right? Well, when we look at the live percentage of pregnancies, we see that Black non-Hispanic populations, they are third in the number of the percentage of pregnancies. So they had 17.7% of live birth pregnancies throughout the city. However, what we see in the associated maternal deaths, they were the highest in maternal deaths at 39.7%. So again, the third rank in actually having the live births, but the highest in associated maternal deaths. Next slide. So again, we did a deep dive into what is happening. And what we found is 74.1% of those pregnancy-associated deaths were preventable. And I'm going to repeat that. They were preventable. That means that a family, a community did not have to suffer the loss of someone who died in their birthing journey. But what we also found was that discrimination contributed to 69% of pregnancy-associated deaths. Discrimination. And then we saw that obesity contributed 13.8% of pregnancy-associated deaths. And then what we're seeing and what is the trend across the nation is substance use disorder contributed to 39.7% of pregnancy-associated deaths. So what we're seeing in New York City, what we're seeing in Westchester County, what we're seeing in New York State, and what we're seeing across the nation is that maternal mental health conditions actually are the leading cause of pregnancy-associated deaths. But what I want to make sure that we understand, and again, please use the QR code to access this mortality report, but what we're seeing is that for Black women and Black birthing people, the leading cause of maternal death is cardiovascular disease. Next slide. So when we talk about maternal mental health conditions, right, what we need to understand is that 1 in 5 pregnant women and birthing people are affected, right? We know that there are stigma, there's shame. We know that sometimes this information can be weaponized against patients. So again, we know that this is happening, but sometimes patients are not screened for it or they're not reporting it. The most common conditions are depression and anxiety. And what I need to, make sure that you understand is that 50% of women and birthing people with perinatal mood and anxiety disorders go untreated. All right. So that means that we all know somebody who during their maternal journey may have depression or anxiety and they're not receiving any treatment. But most importantly, 40% of Black mothers and birthing peoples experience maternal mental health conditions. So 40%. And when we look at that compared to white women, Black women are 2 times as likely to experience a maternal mental health condition, but only half as likely to receive treatment. Next slide. So again, what are the causes for this? Well, social determinants of health. These are non-medical factors that impact and affect our health outcomes. And that could be health access or coverage, or access to quality health care. There could be a language barrier. There could be food insecurity. There could be unstable housing or income or social economic status or education and literacy. There could be environmental conditions. There could be redlining, which is a discriminatory practice that involves denying or limiting financial services to certain neighborhoods, often based on race or ethnicity of residents in that. So it may not have public spaces or more trees or even healthy eating options. And then there could be transportation, and then also there is racism. Next slide. Next slide. So we think about mistrust, we have to talk about there is a history in this country why many women of color, Black women and Black birthing people have mistrust for the medical system. There was Dr. J. Marion Sims, known as the father of gynecology, who was not the father. Okay, he did medical experimentation on enslaved women, specifically Betsy, Lucy, and Anarcha. And often this was to fine tune and develop his own surgical techniques for repairs after childbirth or even bladder or rectal reconstruction. But often these procedures were performed without anesthesia. And Anarcha was subjected to over 30 surgeries without anesthesia. So again, we have to understand that there is a history. So we have to validate when our patients are telling us they are fearful. We have to understand that there's a history in this country because of that. Next slide. So again, this is your toolkit, right? This is what we want to share with you because we want you to have the joy. We want your birth to be the best day of your life and your family's life. So what I say to you is select your provider, research them. You want someone who is gonna participate in shared decision making. They're not gonna decide for you, you decide together. We want someone who is looking at everything through a trauma-informed lens, who is validating your lived experience, someone who is understanding that there could be mistrust, but there's opportunities that we can go over those obstacles so that you can have the best birthing journey. We want you to be very intentional about selecting your hospital and going on a labor and delivery tour. See where you're going to have your baby, developing a birth plan. This is a sense of empowerment so you can advocate for yourself and what you would want to happen on that special day. And doulas, it is evidence-based that doulas will, number one, decrease the C-section rate, decrease preterm labor, decrease postpartum depression, and increase breastfeeding. This is all evidence-based data. And also I encourage you to do childbirth classes and enter prenatal care early. We know that 50% of the pregnancies in this country are unplanned, but when you find out, get into your prenatal care and find out about having the appropriate diet and exercise and really exploring, you know, how you can really take advantage of this time in your life. I get usually two questions from my patients, especially my Black patients and my Black birthing patients. They will say to me, one, they either tell me, I'm pregnant and I don't want to die having this baby. Or the second thing they'll say is, I don't want to have children because I don't want to die. So these are valid concerns that happen. Can we just go to the last slide? One more slide, and that's it. I'm sorry. Okay, so I'm going to leave you with this. You deserve to be heard. You deserve to be believed. You deserve to be seen. We want you to have that joy. You exist, you are valued, and you should have a joyous experience when you travel through your maternal journey. So thank you so much.
Thank you so much. Thank you, Dr. Ashanda. This was wonderful. You deserve to have joy. This was wonderful. I know you guys have a lot of questions, and we're going to save that to the end. We're going to move it along to our next rock star, which is Kate Permute, who serves as the chair of Westchester Women's Agenda and a leading feminist, anti-racist, anti-partisan advocacy organization dedicated to advancing racial, economic, and social equity. In her role, Kate brings us into legislative and policy world where the fight for maternal health equity is shaped. She helps us understand how data and advocacy intersect. Let's bring our next rock star. Kate, are you here?
Yes, I am. Thank you.
Wonderful.
Yes, go to the next slide so you don't see two of me. Let's just start quickly with definitions. For those who don't know, I might not do this every day. Advocacy really is it's a noun and a verb. The noun is advocacy, is public support for or recommendation of a particular policy or cause. And the action verb to advocate is to speak and argue and persuade in support of that particular policy or cause. And our cause here this week, of course, and year round, is to improve outcomes in Black maternal health. Next slide, please. You actually have an advocacy toolkit already at your fingertips. And also in your face, it's your voice. You can make phone calls, send emails, texts, use in-person visits, even comments on people's Facebook pages, Instagram, TikTok, send letters. And the people you're advocating for improvements in Black maternal health can be those within your family, just getting them to talk about it, including local groups, book clubs, clergy, places that you frequent, even the gym, but elected officials who we're going to really focus on here. For all of them, your personal message describing your concerns can be just as powerful as data. So next slide, please. In case you do not know who your elected representatives are, I have them all in my phone. You can find them all through this one wonderful website, usa.gov/elected-officials. On the state, federal, and county level, you'll get the office address, the email, phone numbers, and you'll be connected to their websites as well. And when you reach out to people, one thing to know is that speaking to their staff counts just as much sometimes, because those folks on the front lines are required to relay messages from you, a resident, a voter, a person in their district, to your elected officials. Next slide, please. What we want to talk about is getting legislation that laws, but more than laws, the things that can really help improve Black maternal health outcomes. So some things we advocate for are proposals for bills for new laws. But other things you can advocate for are expansions of programs or pilot initiatives to do new things, policies and regulations that with a little bit of tweaking can really be more culturally competent. And of course, the most wonderful budget allocation can make a big difference. Next slide. So to know what exists right now in terms of legislation, there are a couple of websites you can go to. And both of these you can do text searches on, just put in Black maternal health, and up will pop at congress.gov legislation for current bills under consideration that talk about Black maternal health, and New York State bills at nysenate.gov/legislation. Same thing, you can find out what's on the ticket right now being considered in Albany. Next slide. So this is a quick update on what is actually a proposal for bills in New York State. A bill that starts with an A is in the Assembly. There is a proposal right now to fund a public advertising campaign about maternal depression, which is worthy of our support. These remaining three bills, S is the bill number. It starts for Senate bills. 7110 is a pilot for Medicaid to cover telehealth maternal health programs. Right now it does in person only. The other after that is S6717. It sets up a new review board in New York State to look at causes of infant and fetal mortality. We've got a wonderful maternal mortality review board. Unfortunately, we need to bring back from the past an infant fetal mortality review board for the Department of Health as well. And the last bill is the New York Dignity in Pregnancy and Childbirth Act, which basically requires hospitals to implement implicit bias programs, which I think you heard in Kalia's powerful story. We want our providers to be bias-free. If they're going to be competent providers, they need to serve everyone with respect. And the evidence is there that not all of them do. And this would require and fund training programs that improve our providers in birthing institutions. So last slide is just to say, in my opinion, advocacy is easy as 1, 2, 3. You raise your voice, you share your concerns and ideas, and actually from those new ideas, new laws and policies and programs can start. So let them start with you. Reach out to your elected officials and let them know your concerns about Black maternal health and how New York should have the same outcomes for all birthing people, regardless of race, regardless of income, regardless of the zip code they live in. So thank you so much.
Thank you.
Thank you.
Thank you so much, Kate. That was great. What'd I tell you? Rock star, rock star. We're moving on. She brought the joy to legislation and advocacy. Well, we're on to our next rock star. I know you're on your feet just waiting for the next one. This is a special rock star, Nubia Earth Martin. She is a community birth worker. She's a traditional midwife, and she is founder of Birth from the Earth. And she is dedicated to education and empowerment of maternal health. As a midwife and a community leader, she champions culturally aligned care. She's going to share about doulas and midwives, why they're transforming and how we need them right now. Nubia, are you here?
Yes, I'm here.
All right,
Thank
great.
you.
I'll turn it over to you.
Thank you so much. Greetings, everyone. I'm Nubia Earth from Birth from the Earth, and really just honored to be here with you all. You know, Black maternal health is 24/7 for all of us, but it's just really wonderful to have us all together and just, the power of collective impact. So I'm going to speak tonight a little bit about the roles of continuous labor support and the midwifery model of care, and why those are so crucial right now in these, trying times, and why it's important all the time, I think, to be able to embrace joy, as we've talked about as a theme in pregnancy, postpartum, and just the entire reproductive lifespan, right? So I have been someone who's had the honor of playing both roles in my work in, reproductive health. So I started out as a childbirth educator and as a labor support person. At Birth from the Earth, we use the term birth companion, but same concept pretty much as a doula. And that's somebody that provides education, advocacy, physical support, mental support, connecting you to resources, and is there throughout the duration of your labor to provide physical support. They might be actually providing hands-on massage. They might make sure that you're hydrated throughout labor. And sometimes they might help you to advocate and find that voice that Kate was just talking about, right? To amplify what your needs are. They might help you with putting together a birth plan or communicating things with your provider, whether that's a midwife or an OBGYN, regardless of where you're planning on birthing. So one of the questions I always get is, well, if I'm birthing at home or birthing in a birth center, do I still need continuous labor support? Absolutely, right? Dr. Shonda St. John spoke about all of the benefits of how they can reduce the risk of having a C-section, right? How they reduce the risk of wanting to have pain medication, and they help improve outcomes overall. And the good thing about having labor support is that could be anybody that you trust and feel comfortable with. So it could be your partner, it could be your best friend, it could be a grandmother, it could be somebody that's been trained, to do this, but somebody that you really trust to walk that journey with you. And a specific, distinction that I will make between continuous labor support and the midwifery model of care and midwifery care is that a labor support person is not providing you medical care, but they can absolutely connect you perhaps to your OBGYN, or if you need a higher level of care, to an MFM. They can connect you to people who can give you the medical advice and have that conversation with you so that you can make decisions that keep your pregnancy safe and healthy, but they're not providing medical support. On the other ends of that, as a midwife, you can actually help somebody through preconception, well woman care, pregnancy, labor, birth, and postpartum on the clinical end of things. And midwives are the experts in low risk, healthy pregnancies. And we use a variety of different tools to keep a pregnancy healthy and low risk. So that might be holistic care. We offer things like group prenatals. That could also be lifestyle changes or healthy eating, or connecting you to resources to healthy foods that might reduce the risk of hypertension and high blood pressure and anemia. and the other things that complicate a pregnancy. But the beautiful thing also is that if you need a higher level of care, your midwife can also collaborate with other providers, like an OBGYN, like an MFM. If you need a higher level of care, you can still get that midwifery model. And we think that's so important because the midwifery model of care is one-to-one individualized care. So the care that I might give to Kate might be different than the care that I would give to Dr. Greenwich, depending on what her needs are. And as a midwife, we're able to individualize what people want, meet them where they are, and make sure that they get to be an integral part of their own care. So I just wanted to give a little snippet of that. Those images that you saw, one of those pictures was me providing labor support to somebody years ago. And then the other picture where there were three of us, one of those pictures, you see a labor support person, a birth companion providing comfort. And you see me with a Doppler in my hand, checking baby's heart rate. And it's really important to have that, whole team there to safeguard a pregnancy, make sure that mother and baby are well, right? So one of us is tuning into mom's maternal vital signs and baby's vital signs. And the other one is providing that continuous comfort in a safe space and making sure that that baby can arrive earthside, well, along with mother. So I hope that answers questions. I'm trying to keep it to time. I think I have 10 seconds left. I know there are other presenters, but thank you all so much. Honored to be here with you all and can't wait to hear the next presenter. Thank you.
Wow, 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 wow. Great, Nubia. The joy of doulas. One day I want you to tell me who was there to support you with your pregnancies. We've never discussed that. Well, we're on to the next rock star, and that rock star is a great support to me personally. No one other than Cheryl Hunter Grant. She's inaugural executive director of the Lower Hudson Valley Perinatal Network and is now a consultant working with Sister to Sister and as well as myself. And she will discuss in New York and Westchester, the Birth Equity Improvement Project. Welcome another rock star, Cheryl Hunter Grant.
Thanks so much, Dr. Greenwich. I'm excited to be here and to continue this train moving forward. We're bringing things, as has been mentioned, to look at what's happening in New York State here in Westchester and all to help improve birth outcomes. We're excited about, and the next slide, please. We're excited about New York State's leadership in addressing birth equity with their Perinatal Quality Collaborative, the Birth Equity and Safe Reduction of Primary C-Section Project. This, again, is taking a deep dive in what are the issues contributing to maternal mortality, particularly around Black maternal mortality. We're identifying how racism impacts birth outcomes, looking at policies and practices at the hospital level, looking at recognizing and looking to improve perinatal outcomes and experiences of care for Black birthing people, as well as reducing those primary C-sections with a targeted universal approach, focusing on Black birthing people who have highest rates of this. As we address that, we will be addressing and reducing those rates for every birthing person to meet the 2030 goal. We have 8 birthing hospitals here in New York State and in Westchester County, and all of them are participating. So we're excited about the strength and the power that exists here in the county. Next slide. As was mentioned earlier, the Westchester Black Women's and Maternal Child Center of Excellence has partnered with the county legislator, with Legislator Jude Williams Johnson and the Health Department, the Office for Women, and the Women's Advisory Board to host birth equity town hall meetings where we'll really drill down on what's happening here in the county. 6 of our hospitals have participated thus far. The first 2 were held March 14th. And the second on November 7th in 2024. We've heard from hospitals and community voices on birth equity and what they're doing and learning some of their best practices. We're understanding understanding data and how data is collected and about the birth experience here in Westchester, sharing programs of community programs and others, and the partnerships that are working together to improve birth outcome and increase birth equity, and understanding what the hospitals and community needs are. Next slide, please. And we're so excited on our 3rd birth equity town hall meeting that's pushing the needle forward. We're going to hear from the final two hospitals, and that's on June 5th. So make sure you mark your calendars and save the date so you can be part of that. And in this session, this next session, we'll also be sharing some key birth equity best practices that have been illuminated from the prior two sessions and including this one. We'll also have an overview of the birthing hospital's birth data and celebrate the work that's being done. While there's still a lot more to do, there's still time to celebrate now those steps that have been made to push the needle forward. Next slide. We also wanted to share, and we've shared at the town hall meetings and is a part of the Massachusetts Black Maternal Child Center of Excellence, the state's Maternal Mortality Review Board's report for 2018-2020. And it highlights some of the information that Dr. Ashanti had spoken about earlier. And in this current report, we know that there were 121 pregnancy-related deaths in the state, that the overall pregnancy-related mortality rate is 18.5 deaths per 100,000 live births, and the leading causes of these deaths here in New York State were hemorrhage, number one, embolism, and maternal health conditions, and that was borne out also in the New York City data. Next slide, please. And there's the QR code that you can get the full report. We know that Black women, Black birthing people have a 5 times higher maternal mortality rate than their white counterparts, and that C-sections were deliveries were 3.1 that of vaginal deliveries. Therein lies the focus of the birth equity around the racial discrimination as well as C-sections. And as was stated earlier, almost 74% of these pregnancy-related deaths were preventable. This means we can do something about it. Next slide. And in the report that, next slide, or they left one out. Okay, in the New York State Maternal Mortality and Morbidity Advisory Council, which I chair, we have a report as well. And our report calls for everyone to take a role in making changes. We provided recommendations that address the racial and ethnic disparities in outcome and improve the experience of care of outcome. And all parties can get involved with recognizing and reducing racism and discrimination, addressing the impacts of social determinants of health, and supporting mental health. So we will send out to you the link, and it actually is on the website, the link for the New York State Maternal Mortality and Morbidity Advisory Council's report, so you can see specific ways that you can get involved. Take those advocacy strategies that Kate laid out, put them in action with the data that you see and the talking points in these reports, and you'll be part of the solution so that people can have joy again in their birth. Thank you.
Wow. Thank you so much, Cheryl. That was wonderful. The joy of birth equity. We have the joy of everything tonight. We have the joy of returning maternal journey. We have the joy of advocacy and legislation. We have the joy of doulas. We have the joy of midwives. Okay. Now we're going to hear from another rock star, Dr. Kay Scott, who serves as Associate VP at St. John's Riverside Hospital in Yonkers, where she oversees grants and the Hope Center. She has over 2 decades of experience in healthcare program and design and implementation. I work with Dr. K all the time. It's so a pleasure. I'll be in your office tomorrow, just giving you a heads up if you're going to be there. And Dr. K is going to address what many shy away from, how bias shapes maternal health, and what we can do systemically to change that. So here goes our last rock star, Dr. K.
Thank you, Suzanne. I appreciate it. I really appreciate being here, and I thank you all so much for allowing me to be here. I'm going to show some slides in the background, but I'm going to tell a story as I show those slides. And that is the story of how at St. John's Riverside Hospital, we are facing implicit bias head on. So what is implicit bias? Implicit bias is the underlying attitudes, and next slide, please. thank you. Next, there you go. Are our underlying attitudes that are there without our conscious knowledge. Now, implicit bias serves a good function in our life. If we had to stop and think about every decision we made all day, we would never make a decision. That's the function it serves. Where it is dysfunctional is when we don't understand how those biases impact our interactions with other people. Next slide, please. So the goal of any implicit bias work is so that we can be aware of what our implicit biases are, and we can make choices about our behaviors and understand how we're more likely to interact certain groups and change that. Next slide, please. So how do you prevent implicit bias? And all of this to me comes down to a term that I used a lot in my clinical practice as a social worker, which is mindfulness. Don't rush to conclusions about people. Really stop and take a minute and look at what's going on inside you. Would your assessment of that person be different if the person were a different race? And really commit in your soul to considering each person as an individual. So what did we do, and what are the tools that we brought to the staff at St. John's to begin to do some of this work? And I'm going to tell you, it is not easy work. Next slide, please. So the tool that we chose in conjunction with our community partners and working with Black Women's Blueprint was a tool that's called the Intercultural Development Inventory. And it talks about our cultural mindset as going along a continuum. And what we want to do is move our own and our staff's mindset from denial, which is there are no differences, we all know there is differences, through this continuum over to adaptation. Next slide, please. This is an evidence-based tool. It's been used on over 1 million people. Each person who takes this survey, and the survey takes about 5 to 7 minutes, receives an individual score, and at the end of it, works with a coach to come up with an intercultural development plan. Through our work at St. John's, we have currently taken about 164 people, that's staff, including administrators, all of the maternity staff, and a group of our physicians, our OB physicians, through this. Next slide, please. In addition to what we each learn about ourselves and the plan that we each develop with our coach about how to respond to these biases within ourselves, we also get information about the organization. There are 2 scores that are aggregated for us. One is what's called our perceived orientation. That is how we as an organization perceive our ability to really deal with intercultural differences. Then there is our developmental orientation, which is how we really deal with this. And the interesting piece, next slide, please, is to really look at, as an organization, the top one is a perceived orientation. In that case, was 128. The developmental orientation was 107. And the interesting place to work with yourself and with the staff is around that orientation gap. If you have an orientation gap that is higher than 9 points, that is going to infer that your clients are not going to perceive you as being as culturally competent as you're going to perceive yourself. And I will say to you that St. John's is running between a 19 and 20 on that perceived. So we have work to do. Next slide, please. So I put down here some resources for you. The Intercultural Development Inventory, there is all the backup data on that website there. The other really interesting group I found is Project Implicit. They are also on there. And then for any of you who happen to be a New York State licensed professional, we were all required by April 1st of 25 to have gone through a 2-hour training in implicit bias. A 2-hour training is a wonderful introduction, but the real work occurs when you look at your own patterns, at your own beliefs, and you go back and you actually look at your own cultural background, and then you walk forward from there. So if any of you have questions or comments, I can be reached through these wonderful folks on the screen. I thank you all so much.
Wonderful, wonderful. Thank you, Dr. K.
Thank
That
you,
was
Dr.
wonderful.
K.
Wonderful. Well, as we bring this evening to a close, I just want to take a moment to reflect on the purpose and the urgency that Black Maternal Health Week is. This is not a systemic week. It is a movement, a national call to amplify the voices and experiences and the needs of Black women and birthing people. It's a call to confront justice and demand accountability in a system that has failed many of us too long. Tonight, we heard from passionate and powerful leaders, policy advocates, midwives, clinicians, community organizers, patients, each of them sharing their insights that move us beyond awareness and into action. We have been reminded that the maternal journey should not be one of fear, but one of joy, safety, and respect. We have learned that equity in birth outcomes is possible when we center our cultural competency, our community-based care, our advocacy, and institutional change. Let us not leave this conversation in the virtual space. Take what you've learned tonight and bring it to your hospitals, bring it to your doctors, classrooms, boardrooms, kitchen tables, all your friends, all your sisters, because every mother, every birthing person deserves not to survive, but to thrive, especially in 2025. I thank you for your presence, your passion, your commitment. Thank you to all our moderators. Thank you to Sister to Sister International, Cheryl, Beryl, Cheryl again, everyone. Thank you for having me. And I think I'll turn it over to Cheryl now for question and answers.
Okay, thank you so much. We have covered quite a lot of territory here this evening. And thank you so much, Dr. Greenidge, for doing a fabulous job moderating the panel. And in fact, to all of you and all of our presenters that are here this evening, let's just give everyone a nice round of applause. Okay. And we certainly want to shout out Westchester Medical Center as well. We know they're here with us, and certainly our friends at St. John's Riverside Hospital, whom we work with very closely. We are at time, of course, at this point, but I know there was a wealth of information shared, and we are here to answer any questions that you might have. So we're going to extend the time a bit and certainly just open up the floor for any questions that you might have. There's a question for you, Nubia. Could you please share your thoughts about New York City only recognizing CNMs? I believe it is extremely restrictive. I'm currently pursuing a nursing degree, but would like to take a path to midwifery that doesn't require me to get a nursing degree. Any comments on that?
Sure. Yes. So as Kate Kermit was talking about different legislature, we do currently have a bill to get CPMs, which are certified professional midwives trained specifically in out of hospital birthing settings, to be recognized in New York as they are in 39 other states. But just a correction, so CNMs and CMs are currently recognized in New York State. So certified nurse midwives and also certified midwives. So you don't have to have a nursing background. SUNY Downstate is one of the schools that you can do the certified midwife training. You just have to have a bachelor's degree in any discipline, and then you do the master's degree midwifery level. But we're working on that. So again, reaching out to your legislators in the Assembly and the Senate and saying that you'd like, that additional credential to be recognized in New York. That would absolutely open up more opportunities for midwives and just more opportunities for care for birthing families. So that's a great question. Thank you. And congratulations on your journey to becoming a midwife.
I'm looking at the Q&A, and I know that Beryl is looking as well. And Erica, are we seeing any other questions?
I think I might want to go back up to see if there are any questions.
I just moved to this area a few months ago. I have a brand new 3-bedroom. Use midterm medical travelers, but I'd like to use for at-home births. Is there a way to connect with established midwives and doulas to make this happen. So we have
I
someone.
could answer that too.
Yeah, go
I
right
would,
ahead, please.
yeah, I would just say, I mean, I could connect you to the Home Birth Midwives Collective, but for the most part, the idea about home birth is the person is birthing in the comfort of their home, right? Like the place that feels the most sacred and familiar to them. And, you know, their midwives and their birth team comes to their home, you know, and brings their supplies. So I would say I don't know, but I don't want to speak for all of the midwives in New York State. So I could connect you to the Home Birth Midwives Collective and you could see. But yeah, I think that's a wonderful offering. And maybe even if it was just some educational, you know, things that you offered there so people know about their options for different places that they could birth in your space. And welcome to the area.
And there's a
Great.
I have a
question.
quick
Yeah.
comment on that, actually, Nubia. Given the horrors of maternal care in other states that are happening outside of New York, we may start seeing people coming here to give birth that do want to have that kind of interesting facility and option, because sometimes they're coming here for all other kinds of reproductive care.
Right.
So
Yeah.
it's a very interesting question. I'm going to go do some research on that.
Yeah, we're working on, you know, birth centers, as you know, getting more birth centers here. I would think the only way that that could happen, based on what I know, is if it's operating more as a birth house, so only one person birthing in there with, you know, trained, licensed, you know, midwives, not multiple people birthing in there, because that would be a birth center and there's regulations around that. So, yeah, I mean, desperate times call for desperate measures. So I can imagine that, you know, that could be something that people are seeking out if they don't have permanent residence here, but they're seeking refuge in New York. Yeah, to birth safely. Thank you for that, Kate.
Dr. Brennan, I think maybe Dr. Scott could answer this. Somebody had asked what policies and reasons do doctors have to change their behaviors, and how can we as civilians push those legal and policy changes as they are developed into the future?
I'm going to ask Dr. Greenwich to weigh in on that one because honestly, that is not my area of expertise. I will say that I do feel that the hospitals have a
I can say a couple of
responsibility. Yeah, I feel that the hospitals also have a responsibility in that, both legally and ethically.
Each provider also need to do competent training as well. And that's what we've done at the hospital. And we're constantly reinforcing that with them, what to say, how to say it to patients, making them feel heard. We have this program called Team Birth coming up, which is going to give us huddles as a group. And we'll be able to listen to patients and what their wishes and their desires. And we'll be doing that in front of them and plotting out their care with everyone involved, nurses and the physicians and the anesthesiologists and any doulas and the patient's mom and the husband. Everybody will be there, and we will be able to have a board and we'll be able to discuss the plan. So I think all of this is going to help personally for us at St. John's to give the kind of care that we want and make patients feel like they've been heard, right? Like they want you to know, and even if they don't know, then you have to guide them. What happens is they come in, you ask them, and they don't know, but you have to guide them. We're thinking about, you know, having toolkits. Again, we talked about all the toolkits today, patient toolkit. Well, do you want your water broken? Do you want an epidural? Do you want IV anesthesia? And how we speak to them as physicians matters. And also the staff, it matters the janitor too. Don't think it's just the providers. We've had cases where the doctors are wonderful, but that housekeeper that came in was not good. So everyone, you know, thinks about only the providers, but it's actually a whole team. So we have to have the whole team come in and be aware of how they're talking to everyone and make sure that we're using a language that's universal. And if we can do that, we can break these barriers. That's my opinion.
I just want to say, Ashonda really wanted to say something.
Yes, we want to hear from Ashonda. Please, thank you.
Oh, no, I completely concur and agree with my colleague, Dr. Greenwich. I mean, she's spot on. I mean, I think that uplifting, respectful care uplifting the lived experience, but also understanding that many of us have gone through trauma. And so we want to really look at our patients through a trauma-informed lens, and we want to make sure that we validate their experience. And so I think those are the utmost importance, especially when we think about returning joy to the maternal journey, and we want everyone to have the best outcomes. And so I think uplifting that and uplifting the patient at the same time will elevate their experience and hopefully have the best day of their life.
Okay.
Great, thank you so much.
Can I just add also, I totally agree with Dr. Greenwich and Dr.
I would like to,
Yes, Dr. Silber, we're going to recognize you.
Sure. Oh,
Yeah,
sorry. I
but
didn't mean to jump
yeah,
ahead of
no, that's
anybody.
okay. No, you have the floor, Nubia.
I
And
just
then
wanted-
we'll recognize
Sure.
our audience. Yes, thank you.
Yeah,
You
I
have
just
the
wanted
floor.
to say that we've also done extensive listening sessions with people who have birthed at the hospitals to get their feedback. That feedback has been communicated with the providers, like, Dr. Greenwich said, on all levels. So we're collectively, working on improving based on people's experiences. So I just wanted to add that, amplifying people's actual lived experiences, what they enjoyed, what could have been done better, what was really what brought joy to their experience birthing there, and then replicating that or improving where we need to.
Great, thank you. So you can see there's just a wealth of information on all of these topics. And certainly, Dr. Silber, I know you are at the medical center, Westchester
Yeah.
Medical Center, absolutely. And you had a question or
So
a
I just want to
comment.
say that I think this, no, just a comment that I really think that it can be done. I'm a maternal fetal medicine doctor, and I have been working very hard to demedicalize labor, right, and bring normal labor and physiologic labor back, and with the centered around the patient. And it works, right? Of course, we have moms that are sick and need care and need intervention and need all sorts of things, including C-sections. But for the most part, babies can be born very healthy without much intervention. And we have been able to lower our C-section rate to 15% in first-time moms, and I'm so proud of it. And it takes a village. I agree with everyone. It takes a village. And Nubia, I would like to invite you to come to Westchester to give a lecture on midwifery if you're willing to, if I can contact you to. I am such a fan of your work.
Thank you. I'd love to. I'll send you my email. Thank you.
Excellent. And thank you so much. We were happy to spotlight the medical center during our birth equity town hall earlier on. And again, we look forward to collaborating, to continuing to collaborate with all of the hospitals. So thank you so much, Dr. Silber, for sharing. And then also as we close out here, I know we've got a couple of events coming up, including, of course, a marvelous health fair, in addition to our grand hat parade and scholarship jazz brunch. So that'll be coming up. We're going to tell you about that as we close out. We want to shout out Dunstan at Macaulay and Mabel Tacona, two of our STSI members in Africa. Also Yedida Yehuda, all who join us. STSI is a local and a global organization. And we're so delighted to have our members from all over certainly join us. So I wanted to make those quick shout outs. So did you want to talk about this, Tashai, or? Okay, well, let me just say we've got our pre-Mother's Day jazz brunch and hat parade. It's always fun. We always have a great time, and we're raising funds for scholarships for our STEAM students. And that's coming up on Sunday, May 4th, 2:30 p.m. right in Yonkers at the Royal Regency Hotel. Tickets are only $95 for adults, and children $45 from 3 to 12. So again, you can go to our website, get all the info. Again, always a great event. Then we have a health fair coming up as well. Certainly, Beryl Weaver, did you want to mention it right quick?
Yes, this health fair is Saturday, May 17th from 10 to 2. It will be at the Westchester Community Health Center in Mount Vernon. Please share this information around the community. We have the flyer both in English and Spanish, and we look forward to a wonderful, wonderful event. We'll have a lot of community partners. We'll have activities for children, and it's just going to be a wonderful event. And rain date, by the way, in case it rains on the 17th, we look to have it on the 31st of May. So we're looking forward to you being there. Lots of good health information. We will have Nubia present as well as many of our community partners. So thank you.
Okay, thank you very much. So again, we want to thank you all for joining us this evening. We want to shout out News 12, one of our media partners, and certainly their efforts to help us shine a light on this issue. Mabel, we see you over there in Belgium. Yes, so thank you so much. I was wondering if Kalia is still on. It looks like Kalia may have moved on, but again, we want
I'm
to
still
really
here.
thank you. Still there, Kalia?
Yes.
Yes. So we want you to say a few words. We're hoping you're feeling the love that came your way. And again, want to thank you so much.
Yes, no, I am feeling the love, and thank you so much. I poured my heart into that video, and just to actually be able to see it today was a very emotional journey for me, but I'm hoping that it will make a difference in the lives of so many others. So thank you so much for giving me the opportunity.
Great. Thank you. We appreciate you.
Right. We feel the emotion. I just want to tell you, Kalia, every time I hear that or I see that, it is so emotional, and I'm always touched. So thank you for sharing, and thank you for allowing us to do that.
Great. So we see our steering committee members. We've got our consultants. We could go on for a while. Certainly our Linda Bagley, National Council of Negro Women, always there for us. Great, great community partners. And I see our millennials, Sayadana. I see our board co-chair, our board members, and the list just goes on and on. So we are in it to win it. Vera Cheek, Alyssa, our friends, certainly at Cara Stanley, I see, and just so many others. So we are in it to win it. And it really is going to take a village to change birth outcomes for Black women. So we want to continue on this train. We want you to get enrolled in our vision. We want you to join us at our next Birth Equity Town Hall, which will be June 5th. And we also have a working group. So this is not just a Black Maternal Health Week venture. It's a movement. It's a train. STSI has been on it, and we've been certainly shepherding it and leading the charge. And we want all of you to join us. So on a monthly basis, the work group meets to review stats, to review actions. Where are we with our strategic initiatives, community partners, who's sitting at the table, who's not, who do we need to get at the table, and all of those kinds of things. So again, I want to shout out Beryl Weaver, who is our liaison to our community partners, and certainly shout out our friends at St. John's Riverside Hospital, who have been great, great role models. So thanks to you all. I see there's a couple of questions. I don't want to keep people but so long. You look really okay, Dr. McLaren, thank you. Let's see, what do we have here? Yes, and Dr. McLaren is holistic health, by the way. So she's my holistic doctor as well. So we have whatever you need. We at STSI have them as part of our circle. So again, thank you so much to all of our presenters and all of you who have come and just stayed. To all of you who don't want to go home, hello.
Join us.
There's 50 of you that just don't want to go home.
At our next monthly meeting,
When
please.
is it?
That's 6 o'clock
We
on
love you
May
guys.
22nd.
Abigail,
Please join us.
Abigail, we love you, Abigail. We love you. Dunstanette Macaulay over in Togo. Are you, Dunstanette? All right. Thank you. And Dr. Morrow, we so appreciate Dr. Morrow, always there as part of our Life Coalition, living your fullest every day in Yonkers. Very committed physician, and so many of you here. To Shy Amazon, let's definitely give her a round of applause, as well as Gloria Cunningham, our public relations and actually our media and marketing and so on and so on. They always make us look good. So we love you guys. Thank you so very much. News 12, we love you too. We look forward to seeing you soon. And stay tuned for Team Birthing. We are going to be rocking and rolling in Westchester with Team Birthing. Is that correct, Kay Scott?
That is absolutely correct.
Is that correct? And you guys should know that Dr. Suzanne Greenwich, she is leading the charge for Team Birthing with the physicians at St. John's Riverside Hospital. So I know you want to give that a nice round of applause. So now you see what we're working with, and it really does take a village. It takes a team effort. And guess what? We're going to improve birth outcomes for Black women in Westchester County. And that's a fact. Yes. If you agree with what I said, I want you to raise your hands and say, we will. We will. We will. Thank you so much.